representatives of the medical team, and they are members and heads of the nursing teams from the other provinces, and they will be taking your questions later. They are Ms. Chen Yuquan, the head of the nursing team of Hubei Province. Ms. Chen Hong, head of Anhui nursing team and chief nurse of ICU. Ms. Zhang Liyan, head of Guangxi nursing team and chief nurse. Ms. Song Xia, head of Gansu nursing team. Ms. Yang Zancuo from Qinghai nursing team in assistance of Wuhan. We also have with us Director Li Yang, Deputy Director of Hubei CDC. First, let's give the floor to Mr. Li Yang to brief you on the latest numbers. As of 24 o'clock, March the 10th, the total number of confirmed cases 67773, among which 49978 in Wuhan, accounting for 17% of the whole province. The rest of the cities accounts for 26%, amount to 17,000. In the last 24 hours, newly reported case 13. It has been kept at a double-digit level for 5 days in a row, and all of the 13 cases was in the city of Wuhan. The other 16 cities reported 0 cases yesterday, and no imported cases were reported. For 6 days in a row, the cities outside Wuhan reported 0 cases. Shenongjia, Xiantao, Tianmen, and Xianing and Quanjiang report 0 cases for the 14th consecutive days. As of yesterday, there are still 13,000 patients being treated in hospitals, among which 3,600 are still severe cases, and the total number of deaths 3,046. And yesterday, the newly reported death case amounts to 22 as of yesterday. A total number of discharged 49056. And the newly discharged pace of yesterday 1471, among which 1,212 in Wuhan, accounting for 82% of the whole province. From February the 9th, the newly discharged has surpassed that of the newly confirmed cases, and that trend is continuing. Now let's give the floor to Ms. Chen Yuquan. Friends from the press, good afternoon. I'm the head of the Hubei nursing team. We have a team of 138 people, and under the commission of the provincial government, we arrived at Wuhan on February the 4th. We work in the temporary hospital of Wuchang and giving services to more than 650 patients, and we have realized 0 deaths and 0 complaints and 0 infection. Our medical team was rewarded as the outstanding group in this battle. So first of all of the party members are the first to volunteer And we have organized a party committee at the front line, and the party members have played a key role and leading role, and we have written the words said that the party member on our protective suits, so that the patients can recognize us and seek us for help. So in order to realize this very good connections with our patients. On February the 5th, we began our work in the Wuchang temporary hospital, and at that night we took 200 patients, and several days later we also helped to open up the B section in temporary hospital. 104 nurses are working that day, and all of them are working over 10 hours a day. As of February the 13th, all of the teams have been transferred from Section A to Section from A zone to B zone, in charge of the 300 beds, and at its peak, we attended more than 280 patients at one time. In order to realize zero hospital infection, we carry out trainings and specify the SOP. The operation in temporary hospitals is the first in history, so we've made nursing schedules, procedures, and charters, as well as different forms, so as to realize the standardized process at work. We also have opened up this public account to carry out education and uploaded the training videos online in order to improve efficiency and reduce human resources demand. We also carry out this very clear signatures inside the hospital in order to make sure that everything is in order, so that our doctors, nurses, and our patients can have a sense of belonging. We also attach importance to the easing of pressure. Both the patients and the medical workers are under great psychological pressure at most. In order to ease that pressure, we contact with comic writers to provide us with all kinds of comic pictures and for them to read. And we place these comic pictures at different working places and help us to relax and have a good laugh when we have time to look at those comics. We also have with us psychological experts providing consult 24/7, which is a great support for us. Looking back to the 35 days of working in temporary hospital, we have experienced a lot of hardships, and we are withstanding great risks. When we first arrived, it seems that we do not even have time to take a rest or even have time to have dinner, and nobody seems to show any kind of hesitation. Some of them have just given birth to a kid 9 months ago. Some of their wives are 4 months pregnant, and some of them have their family members are experiencing hardships. But as medical workers, it is our responsibility to answer to the call of the nation and come to the places where we are most needed. Now, Ms. Chen. Friends from the press, good afternoon. I'm with the Anhui medical team, and I'm the chief nurse of ICU, and also the head nurse of cardiovascular ICU of the first hospital affiliated to Anhui Medical University. Now I brief you on our work. First of all, we have convened in a fast manner on January the 26th. Our province have received the emergent order to send ICU nurses to rush to Hubei, and in merely several hours, we have formed a nursing teams of over 50 nurses with more than 10 years of experiences. After arrival, and we have received training, and we began to work in Jingtan Hospital since January the 28th. The 50 team members were assigned to ICUs and critical care wards to attend the patients. We have no fear for difficulties and risks, and make full use of our nursing experiences. For example, the usage of CRT, ECMO, and non-invasive and invasive ventilators. We work with the doctors to finish all kinds of treatment and nursing procedures. We also are in charge of the attending of the patient's daily needs. In the first few days, we are working over 9 hours a day. Protective suits are usually immersed with sweat. Despite a lot of hardships and difficulties and physical pains and pressures, we have overcome all of those hardships and difficulties to completely devote ourselves to the work that is handed over to us by our country. Currently, most of the patients under our care have been discharged, have recovered, or has been transferred to general wards. If the ward is not over, we will never back up, and will continue our effort and use our expertise and nursing techniques to attend to the patients with COVID-19 in order to save more lives. Thank you. Now, Ms. Zhang Liyan, please. From the press, good afternoon. I am the head of Guangxi nursing team. Since the outbreak of the disease, the Guangxi Autonomous Region's Provincial Commission and government attached great importance to the assistance, and we are the second group of medical team from 17 hospitals, and the total number of our team is more than 100, and we are working at Wuchang Temporary Hospital. So zero infection, zero deterioration is our goal. We have 800 beds in our administration, divided into zone A, B, and C. We arrived at Wuhan on February the 4th. After training, we began our work on February the 6th. In a very short period of time, we have admitted more than 200 patients. This constitutes a lot of working pressure for us, but we work in unity and streamline the information of the patients, understand their medical and daily needs in order to do our nursing work well. After approval, we have organized a temporary party committee and have admitted application from 66 team members. Our daily work is the handover of groceries to the patients and to lead the patients to do exercises among other work. We also help with the hospital to carry out fire escape trainings. These activities are meant to improve their physicality and ease their pressure and improve their self-protection awareness. And we aim to let them feel that we are with them and they're not in this alone. I also received a call from my mother and my leader. And my mother said that the regional leaders also visited my home to send their greatest blessing and best wishes, greetings to them. Altogether, we have attended more than 399 patients and more than 150 patients have been discharged, and we will not back up until this war is over. Now, Ms. Song, please. Good afternoon. I'm with Gansu Renmin Hospital and also the head of Gansu nursing team. Basic situation about my team. We are a team of more than 100 professionals, among which 93 are female and 7 are male, 21 party members, and our age ranged from 23 to 49 years old. We are from 53 medical institutions, and we receive the calling on February the 3rd and arrive at Wuhan on February the 5th. We are the second medical team in assistance of Hubei. Some of our work that we have done after arrival and training, we began our work on February the 7th and in the Dongxihu temporary hospitals, taking over more than 200 beds. On the same night, we have admitted more than 50 patients. We have formed teams of 14 so that each team can have the best mix and structure of personnel in order to realize the biggest capacity. Altogether, we have admitted more than 240 patients, among which more than 200 of them have been transferred or has been discharged. We are working under great pressure and risk, but none of us complained. We are working closely together and work in a prudent manner and have realized that 0 deaths, 0 infection, and 0 incidents, 0 complaint, and 0 reinfection of the discharged patients. And we are a very capable nursing team and has been rewarded as an outstanding group by the National Commission. According to deployment, the temporary hospital that we are in charge in have been closed down. And we are now waiting for other callings and in other battlegrounds. I'd like to thank the support of all the people in our country and from our home. And please rest assured that we will show our responsibilities and finish our responsibilities and our mission before returning. Yesterday, General Secretary Xi Jinping visited Wuhan to visit us and send his greetings, send his care and support for us. And we believe that we'll finally win this battle. Now, Ms. Yang Zhencuo. Good afternoon. I am the chief nurse of Qinghai Chinese Medicine Hospital, and I also head of Qinghai nursing team. On February the 4th, we have received orders and formed a team of 102 people in merely a few hours and rushed to the front line of Wuhan. We are assigned to Hongshan Jim Temporary Hospital and the Wuchang Hospital. Wuchang Hospital was one of the first temporary hospital that have been constructed. At first, the logistics were not enough for us, but our team members worked together to overcome the most difficult time period. The temporary hospitals take in the mild cases, so psychological consultation and humanitarian care are both very important. We lead the patients to do physical exercises on a daily basis and help them to maintain a healthy psychological conditions. In the temporary hospitals, we have altogether attended more than 300 patients, and more than 246 of the patients have been discharged. So to take good care of the patients is our responsibility. And psychological support is also important to improve recovery rate. And we have practiced the benevolent spirit of a medical worker. We also want to send our gratitude to the logistic support and care from all walks of life. So we are all in this together, and nobody is fighting this war alone. And it has reconfirmed our competence to fight and win this battle. Now the floor is open to questions. Please make sure to identify yourself first. With Hubei TV, Ms. Chen, how to prevent hospital-acquired infection during your work at the temporary hospital? Working at the front line, hospital-acquired infection prevention is of crucial importance. So we've done this from three perspectives. First, to conduct training. Upon arrival, we invited Dr. Li Liuyi to conduct this prevention of hospital-acquired infection because we know that the sample taken is a very high-risk procedure. So we have to do this kind of individual test of our nurses to make sure that we have mastered the skill, and we have to do this kind of drills before taking our positions. Through such training and practices, we are aiming at making sure that everybody is up to standard when it comes to the standard operation procedure. This PDCA concept has also been applied. When we first arrived here, on a daily basis, the head of the teams will hold a meeting to report some of the problems with the working procedures or technical procedures, and we will discuss plans, measures to further optimize the working flow. Second, we also strengthen hospital-acquired infection in our working place. we have compiled this, worked out this measure in order to prevent hospital-acquired infection, pointing out the key points in terms of disinfection, the division of non-contaminated and contaminated area, the disinfection in our residential places. We'll also check up on the dormitories of our medical workers on a weekly basis. We have posted all the relevant information in our WeChat group so as to strengthen the awareness of prevention of infection. We have also strengthened the sense of responsibility for this team. We have assigned nurses to be in charge of the management of hospital-acquired infection. This is extremely hard work for them because each time we go in and out, they have to go through very strict disinfection processes at the entrance. And our nurses in these posts have shouldered this responsibility, have done their work well. With Anhui TV, Ms. Chen Hong, you are the only chief nurse of ICU team. So what are the differences between the attendance of critical cases and that of the mild cases? As a nurse of the ICU department, the biggest difference is that for the critical cases, they are experiencing heavy syndromes, and we have to be more delicate in terms of time and energy. And a lot of the patients have to undergo non-invasive and invasive ventilation, so it's not easy for them to communicate with us, and we have to find other ways to communicate with them. 3, besides medical treatment, psychological consult and support is also crucial to help them overcome the physical difficulties. Here are some of the work that we've done. First, we made small cards in order to realize targeted care and to facilitate the communication with the patients. For example, have dinner and have drinks or taking out of the flames in order to provide better services. Second, we attach importance to psychological consult and constellation. When they are experiencing physical difficulties and they are also experiencing psychological hardships, will I recover? Would I be quarantined after discharged? Would I infect my parents, my family members? A lot of questions were raised on a daily basis. Anxiety, fear, and unsure, uncertainty, and self-blame. These kind of emotions and negative emotions will not help with the recovery of the patients. So we have formed a psychological team to help them to put the patients at peace and help console them. With Guangxi Daily, so Ms. Zhang Liyan, during your work, the medical workers have contributed so much, and the people back home are very much concerned, and they want to ask you that who are the bravest people that are working in the front line? the words, when at the mention of the words bravery, people would think that the medical workers that are working in temporary hospitals. So we have a lot of colleagues that are working alongside us. But for each of us, we will never forget all of the patients under our care. When we first began our work, we also were not so used to this working style. And one of the patients come to see me and ask a lot of questions. So what do you feel? Are you okay? Do you need my help? So that was very heartening for me. And another time, some of our nurses are helping one of the male patients to cut his hair. And we had a good laugh about it. I think that's also a very heartwarming scene. We have another nurse who is leading the patients to do physical exercises. And after this exercise was finished, the patients bow at her to send their gratitude. So we believe that all of the patients are also brave. And your existence makes us feel that we are not fighting this war on our own. With Gansu TV, my question goes to Ms. Song. As the head of the Gansu nursing team, can you explain to us more your working styles, your characteristics, some of your experiences? Thank you. The working style of us is first to attach importance to humanitarian care and psychological care. In temporary hospitals, they mainly take in mild cases. So besides physical medical care, we also need to carry out this education for medical knowledge as well as psychological consolation to the patients. So patients might show emotions of fear, anxiety, or depression, or pessimism. So our team members spare no efforts to help them, to lead them do exercises. Many of the videos have been posted online. We also have established WeChat groups to facilitate the communication with the patient. So through various methods, we're trying to help the patients relax and obtain a more positive mentality. The party members also play a very important role in this process. Under great pressure, despite the pressure that we're under, the party members are always the first to rush to the front line. As of March the 8th, we have 8 members that have already been admitted, and 34 have been listed as activists in terms of applying to be a party member. We also have undergone a lot of hardships, and we are a team of female workers. Despite the pressure and risks that we are enduring, none of us complained for even once. And we unite very close together and it's not easy for us to come this far. With Qinghai TV, so Ms. Yang Zancuo, what impresses you most during your work with your team members? What impresses me most and makes me proud is that my team members can adapt to the to the environment quickly and overcome the difficulties during the 35 days of work, and despite some of the physical discomfort. And we have completed our duties. Our team leaders and contact person also help us to facilitate all kinds of connections and logistics. And I also want to thank them for their efforts, because it's essential for our operation, and our reward will not be possible without their support. So I'm extremely proud of my team members. Last question. With Hubei TV, spring is notorious for being the flu season, so it's overlapping with the spreading of COVID-19. So what should people do at such a special period of time? Mr. Li. Indeed, the weather is warming up, and everything is resurrecting. The bacteria and viruses are also waking up, which increases pressure of respiratory infection, mainly seasonal flu, measles, and among other diseases, among which seasonal flu is the most common one. And it also has very similar symptoms with COVID-19, fever, coughing, fatigue, for example. But the flu would start in a very acute manner and show symptoms of high fever, and body temperature can be as high as 39 degrees Celsius. And this fear of a cold, headache, and this muscle pain are very obvious, but the respiratory syndromes are comparatively low. And the syndrome will disappear in about 3 to 4 days, and the other physical symptoms will also weaken after a few days. And TB is another very common respiratory disease, and showing symptoms of coughing, low fever, and sweating, fatigue, and so on. But TB fever symptom mainly happen in the afternoon, and it's very low body temperature, and the coughing may last for about more than 2 weeks, and there are even possibility of coughing blood. If you experiencing those similar symptoms, make sure that you go to the hospital to seek medical attention. The flu and TB shown some similar symptoms with COVID-19, but they have completely different pathogens. COVID-19 is caused by coronaviruses, but the TB is intrigued by bacteria, while flu is triggered by flu virus. So we can distinguish these diseases from each other by doing this kind of investigation, epidemiology investigation. But if you are experiencing any of those symptoms, it's important, essential for us to seek medical consultation as soon as you can, because all of these diseases belong to respiratory diseases. So some of the preventive measures can apply to all of these diseases. First is to cut the channel of transmission. Do not spit on the ground. Cover your nose with the tissues when you cough or sneeze. If you do not have tissues with you, you can do it in this way, that is to cover your nose and mouth with your elbows. So personal hygiene is essential in terms of prevention of infectious diseases. Second, we have to reduce the virus intensity and concentration, so ventilation indoors is crucial. It is important that we keep our indoor spaces clean and hygienic. 3, timely isolation. Once a patient is confirmed, timely isolation is important, and you have to work closely with the doctors in terms of the treatment. 4th, strengthen immunity, a balanced diet, the intake of protein, vitamin A, vitamin C, and strengthen physical exercises, and have enough rest, and maintain a healthy mentality. These factors all contribute to the strengthening of personal immunity. Last but not least, to prevent catching the flu, we actually have already have flu vaccines. So you can also receive vaccination. I want to thank all of the speakers, especially our nurses. We are impressed by your stories, your spirits, and we want to thank you for your hard work. Make sure to take enough rest and take care of your health. Thank all of you for the questions. That's all for today's press conference.